Now it's time for TIPisodes with quick tips you should know. Techniques you can implement into your workflow right here on A Tale, oh yeah, A Tale of Two Hygienists.
Hi everybody, my name is Bethany Montoya and I'm a practicing dental hygienist in the Dallas-Fort Worth area. I also serve as an editorial director for Dentistry IQ. I oversee a digital newsletter that we provide called Through the Loops, and I encourage y'all to subscribe to it if you haven't already. And then I also work full-time in dental sleep medicine, where we provide oral appliance therapy exclusively for snoring, sleep apnea, and TMJ disorder. Today I'm going to be sharing some tips with you on screening for sleep-disordered breathing during your routine hygiene visits. In 2019, The Lancet released a study that stated an estimated 936 million adults ages 30 and over have mild to severe obstructive sleep apnea globally. That's a lot of people. We also learned during this study that the United States ranked second in the world's prevalence rate, so we know that it's a real issue in our country. My first recommendation for you would be to interview your patient during their hygiene visit, asking simple questions like, do you snore? Has anyone ever told you that you snore or stop breathing in your sleep? Tell me a little bit more about the quality of your sleep. These are really valuable questions to ask your patients who suffer from TMJ disorder, because we're finding through studies that a significant number of people who have TMJ disorder also suffer from sleep-disordered breathing. Another thing that you might consider implementing into your appointment is using a questionnaire like the Epworth or the Stop Bang. Either one of those can be found very easily on the internet. It asks your patients a series of simple questions to help quantify their risk for having sleep-disordered breathing. I know that we always review our patients' health history during their hygiene appointments, but this would be another really great opportunity to use as a tool for screening your patients for sleep-disordered breathing. Looking for things like hypertension, acid reflux, allergies, asthma, obesity, or mood disorders like anxiety or depression are highly linked to untreated sleep-disordered breathing, and they're great things to note when you're looking over your patient's information. The second tip that I would share is to make sure that you're performing a thorough intra and extraoral exam. I know a lot of us associate this with screening for oral cancer, which is so important to do, but also it serves as a great tool for us to screen our patients for sleep-disordered breathing as well. Looking at things like your patient's neck circumference. Is it greater than 16 inches? Does your patient have a scalloped tongue? Are there signs of wear on their teeth from clenching and grinding? Are the tonsils present? And if so, how big are they? And I would also recommend familiarizing yourself with the Mallampati scale, which gives us a quantitative number of how visible their airway is. My third tip is to review your findings with your patient. It's not enough for us to just tell our patient that we see some concerns and want to refer them to another provider to investigate further. Our patients need to know in detail the things that we're noticing that are causing concern. I also recommend working to dispel the myths that people commonly associate with sleep-disordered breathing. The most common myth that I typically come across in private practice is the idea that snoring is normal and that it's just a part of the aging process, but we know that that's not normal. In fact, somewhere around 80% of adults who snore have some sort of underlying sleep-disordered breathing, so that's important to communicate to our patients. It's also important to let them know that they have options when it comes to getting tested for sleep-disordered breathing as well. For a lot of people, that prevents them from getting treated or tested because they don't want to go to a traditional sleep study center to get tested. And so it's important to let them know that many offices now offer home sleep testing equipment so that they can test in the comfort of their own home. I also recommend letting your patients know that if they do in fact end up testing positive for obstructive sleep apnea, there are treatment options available. We still consider CPAP therapy to be the gold standard when it comes to effectively treating obstructive sleep apnea, but oral appliance therapy is a great alternative for those who can't tolerate CPAP therapy for whatever reason, whether it's a latex allergy or claustrophobic associations or just a bad experience in the past. Letting our patients know that they have options when it comes to testing and treatment can remove a lot of those barriers that keep them from investigating their sleep health in the first place. My fourth and final tip is to know where to refer if you do see these concerns with your patients. Some dental practices do offer home sleep testing equipment and oral appliance therapy, and if so, you'll just want to refer that patient to your dentist to have that conversation to look at the next step. If your office does not, I can't emphasize enough how important it is to develop collaborative relationships with local providers in your area that can help your patient moving forward. Providers like ear, nose, and throat specialists, pulmonologists, and primary care physicians are wonderful options so that your patient can get the testing and potential treatment that they desperately need. Sleep apnea is a serious condition that we just can't ignore with our patients when we see the signs and symptoms. As dental professionals, we have a unique opportunity to help our patients in this area because we see them several times a year and we have direct access to viewing their airway every time that we see them. So we need to make time for these screenings and we need to make sure that we have that relationship established with local providers so that we can direct them to the right person to get them the help that they need. If you're looking for additional resources and becoming more familiar with performing airway assessments, I recommend looking into either the American Sleep Apnea Association, the American Academy of Dental Sleep Medicine, or PubMed, which is offered through the National Library of Medicine. I hope these tips were helpful in assisting you in improving your screening for sleep-disordered breathing. And if you do have any additional questions, feel free to reach out to me. My email is bethanyrdh@outlook.com. Have a great day, guys.
A tale of two hygienists.